right, no matter how hard you work out or how strict your diet is, we all have those stubborn spots of fat or that pooch that just won't go away. I hate it. Dr. Sabrina Fabi from Cosmetic Laser Dermatology right here in the UTC area is here with us today. We're talking about the amazing FDA-approved treatment that works to get rid of that stubborn spot of fat. It's called CoolSculpting. Literally, Dr. Fabi, it freezes your fat?
It freezes your fat. So this is a technology that was developed by two of my friends and colleagues at Harvard. And essentially what they determined is that the fat freezes at a higher temperature than the skin. So you can freeze it selectively and you leave the overlying skin completely intact without any injury or downtime.
Okay, so a lot of people want to know, is there surgery, needles, knives involved?
So no downtime, no needles, nothing invasive, your skin is completely left touched, really. It basically draws up the fat into a little cup and it freezes it over an hour. And so there's no downtime from it. That's probably the reason why it's become such a popular procedure.
And not only that, but it works. So let's take a look at some of the animation of this taking place. And maybe you can describe to us, a person comes into your office and are they laying down on a table when
So
this
you
happens?
can lay down, you can sit up, you can write a paper, you can read a book, you can watch a movie. And so this fat is drawn up into these cups. There's about 5 different cups. And essentially it freezes the fat. And so the fat cells die after that treatment, that 1-hour treatment, and over 4 weeks to even 3 months, you start to see the results because those fat cells are taken up by the body and moved away from that area, and so they're permanently gone.
Okay, so this procedure takes about an hour, you mentioned.
Exactly.
Now, when I get up from the table or from sitting down and I look in the mirror, people need to know, right then you're not going to notice a huge difference.
No, and you're minimally swollen at best. You can basically get off the table and resume your daily activity.
Go back to work.
People do it in their lunchtime, or just to take a couple of hours at the end of the day to come in right after their day. And you can go back to, working out and doing your daily routine.
Okay, so I know people are going to want to know, let me see some before and after pictures. Let me see if this actually works. And you say within one treatment for some folks, it could be 3 or 4 treatments for other folks, they will see a difference.
Most of my patients have only one treatment or only need one treatment.
Look at this picture.
And these are significant results because if you're choosing the right patient, it's someone within their ideal body weight that has these stubborn, recalcitrant pockets of fat that just won't go away in their abdomen, love handles, and thighs.
So like the mommy pooch area. The dad
area.
bod is supposed to be popular right now, but not every dad wants the dad bod, so they could get rid of that.
You'd be surprised. This is probably the most popular procedure for men because men really are more bothered by their body than their face. And so you get these love handles that you can't get rid of, and maybe some of the men don't want to stop drinking their beer. And so what do? And so you can get rid of it after a single treatment.
After a single treatment. Okay, so those before and after pictures were pretty remarkable, especially that lady's stomach there to see what it looked like after.
Of course, so if you're within your ideal body weight, you exercise, you diet, you can't get rid of that pooch. I know that I personally have it done because I'm small, but I can't get rid of that pooch.
I mean, you could do hundreds and hundreds of crunches, and some areas will never look like the 6-pack abs that we see in the magazines.
Right. So this is a great treatment, and you'll see great before and afters when you're an ideal body weight person who has this stubborn pocket of fat, because it will reduce that fat by 20 to 25%.
Wow.
So it doesn't remove everything, but sometimes you don't want to remove everything by liposculpture. And although I do liposculpture at the practice, some patients like yourself or myself don't want 80% of the fat removed because they're sometimes left with loose skin. And so here, with just a little bit of reduction, you can get great before and after results, and there's no downtime from it.
No, so any pain at all, because I'm kind of a wimp.
So there's no pain. So it just draws it up. So it does feel like a pinch initially, but your skin goes numb from the cold. And so patients aren't in pain at all during the procedure. They're rather comfortable. They watch a movie, some even fall asleep.
Wow, this is like cheating.
I know.
The rest of us are going to the gym, and then those of you who already knew about this, you're cheating. All right.
People have been cheating for 5 years already.
This is so awesome. This has been around that long.
Yeah, so it was FDA cleared for the reduction of the abdomen and flanks as well, now more recently for the outer and inner thighs, but it's been cleared and available since 2009.
It's 2009. Okay, where can folks find more information on this?
They should go to CoolSculpting.com so that they can find a local provider in their area, and then that provider can come up with a customized plan to meet the individual's needs.
Okay, and I know folks can find you at the Cosmetic Laser Dermatology office up in the UTC area in case they want to talk to you specifically. So this is fantastic. Now, I was wondering if this is available for everybody, if there's any certain medical condition that might hold people back from doing something like this.
So the only rare person who can't, participate or have this treatment is someone who has antibodies to cold, believe it or not, or someone who's pregnant. It has not been investigated in people who are pregnant, and they probably should wait until they're not. Right? It's like, but otherwise, no, there are no other contraindications. If you have a hernia in the area, probably not the safest treatment to do in that area.
Okay, but that's it.
That's it.
Okay, fantastic. CoolSculpting, again, is the name of the procedure. So if somebody all of a sudden looks like they're in fantastic shape and they haven't been going to the gym, it's probably CoolSculpting. Thanks, Dr. Fabi, for coming in. I do appreciate your time this morning.
Thanks
Keep
for
up the
having
good
me.
work. For more information, go to our website, san diego6.com, and click on San Diego Living.